Another health promotion model, this time looking at how individual change occurs, is known as the stages of change model. A person will go through 5 stages to change a behaviour, and that includes thinking about it, preparing for it, actioning on it, and maintaining the change. It was originally created in relation to quitting smoking, but it's now been applied to all types of behaviour changes across all age groups. Health promotion interventions can occur at any one of the 5 stages. The first stage is pre-contemplation. At this point, a person has no intention of changing. They may not be aware that their behaviours are problematic, or they may feel that they can't change. Health promotion interventions at this point can include social marketing, which will identify areas for potential change and put the information out there in the public arena. The second stage of the stages of change model is contemplation. At this point, people are aware of their problematic behaviours such as smoking, drinking heavily, not exercising. They're considering making changes, but they're not too sure how they should go about that. In stage 3, they're getting ready to begin. They've investigated ways of changing behaviours, they've settled on a plan of action. For not exercising enough, it might be they've just looked around at what they can do in their community, either go to the gym, walk, etc., and they've decided that once a week they're going to try and go down to the local pool for a swim. This is known as preparation. Stage 4, we're now in the action stage. The behaviour is being changed, and it's not yet reached 6 months maintenance of the change behaviour though. So they're swimming, they're going well. In stage 5, maintenance. The behaviour's been changed for 6 months, but the person is still vulnerable to temptation to resort to previous behaviour. There's still that risk that if something comes up, they might not go for the swim this week. They might go, oh no, I'm going to go out for dinner with friends and miss the swim, miss a couple of swims, and it gets harder to get back into that action stage. As I mentioned before in these stages of change model, social marketing can be used to get information about health out there in the public eye. It does come from product marketing and the marketing mix. And it's media, advertising and communication with a message in order to encourage behaviour change. This may not always occur. Just because you give someone information doesn't mean they'll change their behaviour. It's like the old saying, you can lead a horse to water, but you can't make him drink. Social marketing, however, can be helpful for people that are in the contemplation and preparation stages of changing their behaviour. You can provide them with additional information, and that might just push them over the edge towards changing that unhealthy behaviour. Some examples of some major social marketing campaigns include quit smoking advertisements and also the crash advertisements used by Queensland Transport to encourage safer driving. These have been very graphic advertisements which really show the consequences of drink driving, speeding, all those risky driving behaviours. Other graphic quit messages, such as those quit messages on cigarette packets where they're showing, rotting teeth, rotting gangrenous limbs, etc., stroke clots, things like that. The point of social marketing is to get the information out there so that people can be informed. And it can work. It will more than likely not work as a mainstream strategy, but it's a very good backup strategy added to a proceed-based health promotion model or a stages of change model. I hope that you've learned something about health promotion and how it works today. If you'd like any more information, feel free to visit my website www.vireohealthpromotions.com or send me an email info@vireohealthpromotions.com. If you are in the Southeast Queensland area, I am a provider of workplace wellbeing solutions and am more than happy to come out, have a chat with you and give you a quote about how you can make your workplace a healthier place to be. Thank you very much.